As with the most developments in life, artificial intelligence will have beneficial on society as it continues to reshape the environment we live in. How that will balance out is anyone's estimate, and it will be a topic of considerable debate and thought for many people. As an optimist at heart, I feel the changes will be generally positive. In today's culture, artificial intelligence is altering the profession of medicine. It assists clinicians in diagnosing patients, making prediction about their future health, and recommending better therapies. In the realm of medical sciences, computer algorithms have attained accuracies comparable to human specialists. The following is a typical pattern for artificial intelligence systems in healthcare. Such a system begins with a vast quantity of data and then employs machine learning algorithms to collect information, which is then utilized to provide a meaningful output to address a well-defined problem in the medical system. Clinical imaging data has been utilized to construct classification models to help clinicians in the diagnosis of rosacea, shingles, and vitiligo. In the field of visually oriented specialties, such as dermatology, because AI models can learn and remember preferences, virtual AI assistants may make precision medicine easier to support. AI has the ability to give patients with personalized real-time advice around the clock. Rather than having to repeat information with each new individual, a healthcare system might provide patients with a 24-hour access to an AI-powered assistant who could answer inquiries depending on the patient's medical history, preferences, and personal requirements. It has been demonstrated that deep convolutional neural networks, or DCNN, outperform 21 certified dermatologists. Their research demonstrated that AI systems were capable of classifying skin cancers with a level of competence comparable to dermatologists and required only a fraction of the time to train the model in comparison to physicians who spent years in medical school and relied on the experience they gained through patient diagnosis over a decade. Programming is just one of the many components that go in the use of AI in any field. For the continued growth, development, and success of AI applications in healthcare, physicians and data scientists must continue to collaborate to build meaningful AI systems. Physicians must understand what AI is capable of and assess how AI can improve their role. Physicians must communicate this information to data scientists who will use it to create an AI system despite some limitation, such as data availability issues. AI appears poised to revolutionize the healthcare industry. Patients can also benefit from artificially intelligent systems in terms of follow-up care and the availability of prescription drug alternatives. AI is also capable of remotely diagnosing patients, allowing medical services to be provided in remote areas. In developing countries around the world, a lack of trained healthcare providers such as ultrasound technicians and radiologists can severely limit access to life-saving care. By taking over some of the diagnostic duties normally assigned to humans, artificial intelligence could help mitigate the impact of this severe shortage of qualified clinical staff. The future of AI in healthcare is bright and promising, but there is still much work to be done.